Poor circulation and loss of feeling contribute to the diabetic's inability to heal normally. Dr. Steven Beutler of the Wound Care Center at Redlands Community Hospital tells us how improved methods of treatment speed recovery for diabetic wounds.
Diabetics get wounds for a number of reasons. I think the two primary things that predispose them to getting wounds is that they have, by nature of having diabetes, poor circulation, mainly in their small blood vessels. This results in the skin and underlying soft tissue not receiving the oxygen and nourishment they need to be healthy. Many diabetics are unable to have normal sensation in their feet, so that if they have any sort of injury, they may not notice it before it's advanced to a stage where it actually continues to break down and becomes infected. So you have a combination of those two things coupled with such problems as ill-fitting shoes or walking around barefoot and getting a splinter or a stone, or sometimes even we'll see people come in with being stuck with a diabetic needle that had fallen on the floor, an insulin needle that had fallen on the floor. That's a recipe for the development of wounds in these patients. It's a really dangerous problem and a serious problem, both in terms of numbers and in terms of severity. 5% of adult diabetics will develop foot ulcers any given year, and over their lifetime, at least 1% of diabetics will wind up with requiring some sort of amputation. So it really is a very serious problem. Once the wounds are infected, antibiotics are required, but before infection sets in, it's important to employ shoes that fit properly and don't rub against the involved area. There are certain types of dressings that can be used to prevent the wound from either being too dry or too moist. I think the medical community has recognized that a multidisciplinary approach is necessary to provide optimal care to diabetics with wound infections. And wound centers have developed which draw from all the different specialties required to provide good care. First of all, in a diabetic, any wound on the foot is of concern and needs to have early and immediate attention. It won't need surgery initially, it probably won't need antibiotics initially, but it may need measures taken to keep the pressure off of it, or special dressings to allow it to heal more rapidly. I think most people, particularly non-diabetics, have a pretty good idea what's quote-unquote normal for them when they sustain a minor injury. Everybody gets scrapes and scratches, and they may heal in a period of 2, 3, 4 days. I think a reason for concern is if redness develops around the wound, if streaks emanate from the wound, if there's fever, or after what seems like a normal period of time for the severity of the wound, there's no improvement. Normally the wound will get smaller on a daily basis and the tissue will look fairly healthy around it. If that doesn't happen, it's worth consulting a physician, and if it doesn't respond to local care, then perhaps it should be evaluated by a wound care specialist.